Hello everyone. Here we are going to discuss about the patient counseling. At the end of the session, the students should learn about the concept of patient counseling, outcome of patient counseling, role of pharmacist in patient counseling, the prerequisites required for the patient counseling, and steps involved in a patient counseling. To begin with the concept of patient counseling, the major task to be performed by community pharmacist is to provide counseling to the patients. It is the process through which healthcare professional attempts to increase patient knowledge of healthcare issues. Patient counseling is defined as providing medication information orally or in written form to the patient or their representatives on directions of use, advice on side effects, precautions, storage, diet and lifestyle modifications. The patient counseling process provides for the exchange of information between the patient and healthcare practitioner. Coming to the outcome of patient counseling, patients should recognize the importance of medication for their well-being. A working relationship and a foundation for continuous interaction and consultation with a pharmacist should be established. Patient understanding of strategies to deal with the side effects of medication and drug interaction should be improved and motivates the patient to take medicines for improvement of his or her health status. Another benefits of patient counseling are patient becomes an informed, efficient and active participant in disease treatment and self-care management. It also develops the ability in patient to take appropriate medication related decision concerning the compliance or adherence to their medication regimen. These are the prerequisites for the patient counseling, which includes environment, training, knowledge and communication skills of pharmacist, counseling aids which is required during the patient counseling, and receptive mood of patient. The first requirement for patient counseling is environment. It is one of the important parameters which affects the patient counseling process. Environment should be conducive to proper interaction between the pharmacist and patient. Counseling can be done while dispensing the medication at the counter, or occasionally a separate room or area can be set aside for it. Privacy and confidentiality of patient problem can be maintained during the patient counseling. Second requirement for patient counseling is training to pharmacist about the knowledge of drug, disease and dosage form, and very important one is the communication skill of the pharmacist. Pharmacists should have good knowledge of the drugs and should constantly keep themselves updated with new drugs, formulations, techniques and devices through available resources. Pharmacists should have excellent communication and convincing skills and should have a command on a language. Now coming to next prerequisite, that is counseling aids. Pharmacists should use various counseling aids during patient counseling process. It includes patient information leaflets, pictograms, models and charts. First counseling aid is patient information leaflet. Patient information leaflets are a means of educating the patient about their condition, illness and how can they take care of themselves. Patient information leaflets are available in local languages. It is simple, easy to understand, written information about the drugs and disease condition. It gives information about the illness and also instruct about how, why, when, how much and how long should one take the medication along with the precautions, side effects of drugs, preferred diet regimens and storage conditions of medication. Such leaflets can be circulated to various retail and hospital pharmacies, and from here they can be given to patient during the purchase of respective medicine. The second counseling aid is pictogram, a non-verbal means of communication in the form of pictures explaining the direction in which the medication should be taken or precautions to be taken is referred as a pictogram. Pictograms have proved very beneficial, especially for illiterate and the people who are mute. Pictograms may contain different body parts so that the customer can point out or identify the symptoms and the body part which is affected due to disease condition. Another patient counseling aid is model or charts. Certain general instructions can be displayed in a pharmacy in the form of written matter on a chart, which generally includes take medication at a definite time and definite time intervals. If the dose of patient is missed, take it as soon as remember, but do not take 2 doses at a time. Do not discontinue a drug therapy without consultation with a physician or pharmacist. Discard the expired medicine by destroying them. It is one of the important instructions which is usually displayed. Do not store medicines in a kitchen or bathrooms. Store all the medicines in a cool, in a dry place away from the heat, light and away from the children. And preferably visit the same pharmacist every time. The next requirement for patient counseling is receptive mood of patient. It is also necessary that the patient regards a pharmacist as a professional who offers pharmaceutical care. Patient should understand and recognize the importance of getting counseled for his well-being. This slide shows the various steps involved in patient counseling process, which includes pre-counseling session, counseling session and conclusion of counseling. To begin with the first step of patient counseling, which is pre-counseling session. In this step, introduce yourself and know the patient. Explain the purpose and importance of counseling that you are giving to your patient. Review the patient medication record for previous medication history. Ask them about any allergies, whether the patient is using any other medicines, any other heredity problem prior to the counseling session. Assess the patient understanding of the reasons for the therapy. Also warn the patient about taking other medications including over-the-counter drugs, herbal drugs and alcohol which could inhibit or interact into the prescribed medication. Determines whether the patient has any other medical conditions that could influence the effects of their drug or enhance the likelihood of adverse drug reactions. Second step of counseling is actual counseling of patient. Following points should be considered during the counseling session. First, discuss the name and indications of medication to the patient. Explain the dosage regimen including duration of therapy. Assist the patient in developing a plan to incorporate the medication regimen into his or her daily routine. Explain how long it will take for the drug to show its effect. Discuss storage and refill information about the drug. Emphasize the benefits of completing the medication as prescribed. Discuss the potential side effect of the drug with the patient. Discuss how to prevent or manage the side effects of the drug. Also discuss the precautions required during the therapy. Discuss the significant drug-food and drug-disease interaction. Explain precisely what to do if the patient misses the dose and explore the potential problem of the patient during the counseling session. During the counseling process, pharmacists should provide accurate information about the drug and dosage form to the patient. Also use the language that the patient is likely to understand. Use the appropriate counseling aids to support the counseling. Present the fact and order in a logical order. Maintain control and direction of the counseling session. Pharmacists can also use the prompts for the additional information which may be in the form of charts, pictograms or information leaflet. Pharmacists can use open-ended question, also display effective non-verbal behaviors in their pharmacy. Finally, pharmacists should conclude the counseling session by emphasizing key points of information. Verify the patient understanding via feedback and assess them by their body language and by their facial expression. Provide an opportunity for final concerns or the questions. And also motivate and help the patient to plan, follow up and next consecutive steps. So at the end of this presentation we can say that effective patient counseling aims to produce the following results. Better patient understanding of their illness and the role of medication in its treatment, improved medication adherence, more effective drug treatment, reduced incidence of adverse effects and unnecessary healthcare cost, improved quality of life for the patient, better coping strategies to deal with the medication related adverse effect, and improved professional rapport between the patient and pharmacist. So to conclude this presentation, at last we can say that patient counseling is a part and parcel of good medication. A good counseling can provide a patient to take his medication happily without any hesitation.